Copyright 2018. Wolters Kluwer. Chapter 16. The nursing role in providing comfort during labor and birth. Experiences of pain during labor and birth, etiology, physiology, perception, influencing factors, anxiety, worry, body image, self-efficacy, availability of support people, expectations and preparation for labor, comfort and pain relief, support from doula or coach, alternative therapies, complementary and alternative, non-pharmacologic pain management, complementary and alternative therapies, relaxation, focusing and imagery, spirituality, breathing techniques, herbal preparations, aromatherapy and essential oils, heat or cold application, bathing or hydrotherapy, therapeutic touch and massage, yoga and meditation, reflexology, hypnosis, biofeedback, transcutaneous, warm water bath during labor, transcutaneous electrical nerve stimulation, TENS, intracutaneous nerve stimulation, acupuncture and acupressure, comfort and pain relief, pharmacologic measures, goals, preparation, narcotic analgesics, intrathecal, regional anesthesia, analgesics and anesthetics commonly used in labor and birth, regional anesthesia, injection of local anesthesia to block specific nerve pathways, epidural anesthesia, spinal anesthesia, medication for pain relief, birth, local anesthesia, local infiltration, pudendal nerve block, general anesthesia. 2020 National Health Goals related to pain relief during labor: reduce the maternal mortality rate to no more than 11.4 deaths per 100,000 live births from a baseline of 12.7 per 100,000. Reduce the fetal/newborn death rate during the perinatal period, 28 weeks of gestation to 7 days after birth, to no more than 5.9 per 1,000 live births from a baseline of 6.6 per 1,000 live births. Assessing pain and pain relief during labor and birth: listen carefully to not only what a woman says but also how she rates her discomfort level on a pain assessment scale. Look for subtle signs such as facial tenseness, flushing or paleness, hands clenched in fists, rapid breathing, or rapid pulse rate. Nursing diagnoses: pain relief during labor and birth, anxiety related to more pain than expected from labor contractions. Ineffective coping related to combination of uterine contractions and anxiety. Pain related to labor contractions. Outcomes: pain relief during labor and birth, patient identifies beginning and ending of contractions, expresses confidence rather than confusion about ongoing process, states she feels less anxious and is able to concentrate on controlled breathing. Patient states pain is reduced to a tolerable level with techniques used so she is able to handle or work with contractions and demonstrates ability to listen and respond to questions and instructions. Patient demonstrates effective coping by expressing confidence in her ability to maintain active participation during labor, using continued breathing techniques, expressing need to change position, and verbalizing confidence in healthcare providers. Therapeutic techniques to promote pain relief during labor and birth. Epidural anesthesia. Delayed until cervix dilated 3 to 5 centimeters. Begin for ringers lactate. Check that equipment for blood pressure monitoring in place and functioning. Help position woman on her side. Aftercare. Be in continuous attendance, recording vital signs and monitoring for complications. Epidural anesthesia. Therapeutic techniques to promote pain relief during labor and birth. Spinal anesthesia. Begin for fluid such ringers lactate. Position and steady woman. Monitor for complications. General anesthesia. Prepare drugs, ephedrine, atropine sulfate, thiopental sodium, succinylcholine, diazepam, isoproterenol. Prepare equipment, laryngoscope, endotracheal tube, breathing bag with 100% oxygen, suction catheter and suction source. Interventions to prevent aspiration of vomitus. Woman with unique concerns. Morbidly obese woman. Woman with cultural concerns. Woman addicted to illicit or prescription drugs. Woman who uses tobacco. Woman with unique concerns. Morbidly obese woman. Woman with cultural concerns. Woman addicted to illicit or prescription drugs. Woman who uses tobacco. Question: A 19-year-old first-time mother in the second stage of labor who has been given an epidural reports severe, unrelenting abdominal pain and rates it as 10 on a scale of 0 to 10. As the nurse, what should you do? Continued slide 27. Question 2: Proceed with standard care. The nurse knows that this is typical in the second stage of labor and that younger women and those who are first-time mothers are more likely to report severe pain. Call the obstetrician. Severe unrelenting abdominal pain could indicate placental abruption, uterine rupture, or other undiagnosed complication. Call the anesthetist, who is responsible for managing the epidural and should be monitoring the woman's pain. Discuss with the woman the additional pain medication options available to her at this stage in her labor so that she can choose which option she prefers. B. Call the obstetrician. Severe unrelenting abdominal pain could indicate placental abruption, uterine rupture, or other undiagnosed complication. Rationale: after an epidural is in place, if the woman reports unrelenting pain, the provider must be contacted for a complication. The nurse is assisting a woman through labor, monitoring her closely now that she has received an epidural. The nurse would report which finding to the anesthesiologist. Dry, cracked lips. Urinary retention. Rapid progress of labor. Inability to push. D. Inability to push. Rationale: if she is not able to push, her epidural dose may be adjusted to decrease the impact on the sensory system. A woman has just received 4 sedation. What must the nurse tell the woman to do? Ambulate only with assistance from the nurse or caregiver. Ambulate within 15 minutes to prevent spinal headache. Sit on the edge of the bed with her feet dangling before ambulating. Remain in bed for at least 30 minutes. A. Ambulate only with assistance from the nurse or caregiver. Rationale: the patient may have decreased sensory reactions from the medication. She needs assistance to ambulate for safety.